Time of the year with low winter temperatures and home heating systems running for days on end, we see an increase in carbon monoxide poisoning. Dr. Carey, an emergency medicine physician at Hartford Hospital, tells us what to do in case you may come in contact. And doctor, this is also timely with power outages expected and people might be rolling generators out unsafely. Have we started seeing cases of carbon monoxide exposure?
So yes, in the emergency department, we can see these cases year round. However, like you said, now the temperatures are dropping, people are pulling their generators out. We are seeing kind of the rise in cases as people, use their fireplaces as well, and especially with warming your car up before work in an enclosed space such as your garage.
Doctor, how long do you have to be exposed to carbon monoxide to be affected?
So, it really depends on the concentration in the air. In smaller spaces, such as your garage or an unventilated room, it can be in several moments. If kind of the more typical exposure that we're going to see can be 6 or 8 hours in a smaller concentrated environment.
All right, let's talk about the symptoms of carbon monoxide poisoning.
So they can be, as simple as a flu-like illness, just feeling bad, having what we call malaise or dizziness or lightheadedness. The most common symptom that we're going to see is a headache. Especially we want to pay attention to this if it's multiple people in the household or even children and small pets, as they may kind of be more at a higher risk given their size. You can see nausea, confusion, shortness of breath. It can go all the way to loss of consciousness or even coma in severe cases.
And exactly what happens in the body?
So that carbon monoxide actually binds to the iron in your bloodstream. It displaces the oxygen that's typically there, and it deprives your brain, heart, and your other vital organs of the oxygen they need to function. So it essentially prevents your tissues from being able to breathe.
Wow. All right. How do you treat someone based on someone's exposure level?
So the most important thing is to remove the person from the environment. That's number 1, 2, and 3. You want to contact 911. The fire department does have portable carbon monoxide detectors to where they can kind of confirm that. But if it's suspected, we always want to see you in the emergency department. Our mainstay of treatment is providing oxygen. This can be high flow from a face mask all the way up into more severe exposures to having to dive you in a hyperbaric chamber.
Doctor, let's talk about carbon monoxide detectors. What is the rule? Where should you put them? How many should you have?
So, it's a great idea to have them throughout your house. I would have one at least on every floor of your house and around any sort of lesser ventilated area. Especially we want to have them around fireplaces. If you happen to have a generator in, near, or around the house, we want to have one there. Just pay close attention to them. Don't ever think that a beeping fire or carbon monoxide detector is not an actual emergency. You always want to check those batteries frequently and have your home inspected, for your heating system, your fireplace, and your carbon monoxide detectors at least yearly, and especially around this time of year.
Excellent advice, because you see people who fall victim to this. Emergency medicine physician at Hartford Hospital, thank you very much, Dr. Carey.